Do you know the nighttime signs of diabetes you shouldn't ignore? Recognizing the early signs of diabetes is crucial. Diabetes, a health condition affecting millions worldwide, can be managed effectively if detected early. The trick lies in spotting those little signals your body is sending you, especially those that occur at night. In this video, we'll be exploring 10 common nighttime symptoms of diabetes that often go unnoticed. These symptoms, though subtle, can be your body's way of alerting you to the fact that something might be off. Whether it's frequent trips to the bathroom, an unusual thirst, or even restless legs, understanding these symptoms can help you take timely action and possibly prevent long-term health issues. Remember, knowledge is power. The more you know about these symptoms, the better equipped you'll be to manage them effectively. So, stay tuned as we delve into these symptoms and provide you with practical advice to manage them effectively. The first sign to watch out for is frequent urination at night, also known as nocturia. It's a common symptom in individuals with diabetes due to high blood sugar levels. When there's excess sugar in your bloodstream, your kidneys are forced to work overtime to filter and absorb it. But sometimes they can't keep up, and the sugar is excreted in your urine, dragging along fluids from your tissues, which results in frequent urination. This process can happen at any time, but it might be more noticeable at night when your body is trying to rest. If you find yourself waking up more than once in the night to use the bathroom, it's worth discussing with your healthcare provider. They can help determine if diabetes could be the underlying cause of your nocturia. Remember, persistent nocturia is not normal and could be an early sign of diabetes. The second symptom is unusual thirst, particularly at night. Now, we've all experienced thirst, but the thirst associated with diabetes is different. It's persistent, it's intense, and it doesn't go away even after drinking plenty of fluids. This is because high blood sugar levels can cause dehydration in your body, which triggers this unquenchable thirst. Imagine it like this. Your body is a well-oiled machine, but when sugar levels rise, it's as if sand is thrown into the gears. Your system then requires more water to flush out the sugar and keep things running smoothly. So, how do you tell the difference between regular thirst and diabetes-related thirst? A good rule of thumb is to pay attention to consistency. If you're frequently waking up parched in the middle of the night, despite having had enough to drink during the day, it could be a sign of something more serious. If you find yourself constantly reaching for a glass of water at night, it's time to consult your doctor. Dry mouth is another nighttime symptom that people often overlook. You might find yourself waking up parched, reaching for a glass of water more often than not. But why does this happen? Well, in the context of diabetes, high blood sugar levels can lead to dehydration, causing your mouth to feel dry. On the other hand, diabetes can also lead to reduced saliva production. Saliva plays a crucial role in keeping your mouth moist and helps in the process of digestion. Therefore, a reduction in its production could leave you with an uncomfortable dry mouth. So what should you do if you experience this symptom? Firstly, it's essential not to ignore it. Take note if your mouth is consistently dry, particularly during the night. It's always a good idea to discuss these symptoms with your healthcare provider, who can guide you further. Remember, a persistently dry mouth, especially at night, could be a sign of diabetes. Night sweats can be an unsettling symptom of diabetes. This is often due to the body's struggle to regulate insulin during sleep. As the body's insulin levels drop, it might release stress hormones. These hormones can stimulate the production of sugar and fat in the body, which can cause the body to heat up and result in night sweats. It's also worth noting that hyperglycemia, a condition where your blood sugar drops too low, can lead to night sweats as well. This can be particularly common if you're taking insulin or other types of diabetes medications. So, how do you manage this? Firstly, ensure your room is cool and well ventilated. Using breathable bedding can also help. It's important to monitor your blood sugar levels before bed and adjust your medication or snack intake as needed. Most importantly, it's crucial to maintain open communication with your healthcare provider about these symptoms. They can help you adjust your treatment plan to better manage your blood sugar levels at night. Remember, regular night sweats are not normal and should be discussed with your doctor. Restless legs at night could be more than just discomfort. It could be a sign of diabetes. Yes, indeed, it may sound surprising, but there's a connection between the two. Restless leg syndrome, or RLS, is characterized by an irresistible urge to move your legs, particularly at night. This can interfere with your sleep, leaving you feeling exhausted during the day. Research suggests that people with diabetes are more likely to experience RLS than those without. This could be due to nerve damage caused by high blood sugar levels, a condition known as diabetic neuropathy. Other potential factors may include iron deficiency or kidney failure, which are also common in people with diabetes. So, when should you seek medical advice? If you're frequently experiencing restless legs, particularly if it's accompanied by other symptoms like numbness, tingling or pain, it's time to speak with your doctor. Remember, early detection and management can prevent complications and improve your quality of life. If your legs won't let you rest at night, it's time to consult your doctor. Unusual hunger at night can be a symptom of diabetes. This symptom is often referred to as polyphagia. Now you may wonder, why does diabetes cause excessive hunger? It's because of how your body uses glucose, the sugar that fuels your cells. In a person with diabetes, insulin, the hormone that helps glucose enter cells, is either insufficient or doesn't work properly. As a result, glucose stays in the bloodstream, and your cells don't get the energy they need. This can lead to a feeling of constant hunger, even if you've just eaten. Now, if you regularly find yourself feeling ravenous in the small hours, don't ignore it. Instead of reaching for a midnight snack, consider checking your blood sugar levels. It's essential to recognize and address these signs early to prevent long-term complications. Remember, your health is in your hands, and every step counts. If you find yourself raiding the fridge at night, it may be time to check your blood sugar levels. Insomnia, or difficulty sleeping, can be a sign of diabetes. This condition often keeps people awake when they should be deep in slumber, leaving them feeling drained and exhausted during the day. You see, when your blood sugar levels are high, your kidneys try to get rid of the extra sugar by producing more urine. This can lead to frequent trips to the bathroom, especially at night, disrupting your sleep. But it's not just about the physical disturbances. High sugar levels can also cause restlessness and anxiety, making it even harder to fall asleep. Now, how can you manage this? Regular exercise, a balanced diet, and maintaining a consistent sleep schedule can help. You might also consider speaking to a healthcare professional about your symptoms. Remember, sleep is not a luxury, it's a necessity. Your body needs it to function effectively. So, if you're having trouble sleeping, it could be due to high blood sugar levels. Waking up with headaches can be more than just an inconvenience. It could be a sign of diabetes. You see, diabetes can cause headaches due to fluctuations in blood sugar levels. When your body doesn't have enough insulin to allow glucose into cells, this glucose builds up in your bloodstream. This can lead to dehydration, which often results in headaches. Similarly, when you take insulin or medication to lower your blood sugar, it might drop too low, causing hypoglycemia, another common trigger for headaches. Now, it's important to remember that not all headaches are diabetes-related. However, if you notice a pattern of waking up with headaches, especially if they're accompanied by other symptoms such as excessive thirst or frequent urination, it could indicate a problem with your blood sugar management. You don't have to suffer in silence. Seeking medical advice is crucial. If you frequently wake up with headaches, it's time to consult your doctor. Do not ignore these nighttime signs of diabetes. We've taken a comprehensive journey through the 10 common nighttime signs of diabetes. From frequent urination, unusual thirst and a dry mouth, to night sweats, restless legs and nighttime hunger, we've also highlighted insomnia and frequent headaches as potential indicators. Each sign is a piece of the puzzle, and together they paint a picture that should not be overlooked. If you or a loved one are experiencing these symptoms, it's crucial to seek medical advice promptly. Diabetes can often be managed effectively, particularly when detected early. But remember, these signs are not a definitive diagnosis. They are signals from your body, urging you to pay attention and take action. Ignoring them might lead to complications down the line. So listen to your body. Seek professional help when in doubt. Remember, early detection is key in managing diabetes effectively. Stay alert, stay informed, and stay healthy.